Hello and welcome everyone. My name is Jasmine Alderson. I'm the spa director here at LUX Medical Spa. I'm just letting everyone into the meeting now. And we are going live on Facebook. So if you're watching us live on Facebook, thank you so much for joining us today as well. And everyone that's here on Zoom, thank you for joining us. This will also be recorded and posted later for our YouTube channel. So if you have, if you've been curious about any of the virtual open house events that we have done, all of those have been posted on our YouTube channel. So please go and like and subscribe to that, and you can see everything. I wanted to start today's presentation on the Lumen chemical peels and peel pads with a quick poll, just to get an idea of what brings everybody here today, an idea of kind of your experience with Lumen Skin Care products or with the chemical peels. And so if you'll just take a second to fill this out. I'll start our introduction here. Basically question number one, and this is only available to fill out if you're visiting us via Zoom. So what brings you here today? One option is I use Lumen Skin Care products and want to know more about the peels. The second one is to learn more about chemical peels. And lastly, to win a free chemical peel, because we are giving away a free Lumen Restore and Relux chemical peel at the end of the presentation. The second question is, have you had a chemical peel before? And that should be a question, not a period. Sorry about that, ladies. So far, 60% have said no, 20% said yes, they have, but has not been with Lumen, and 20% say yes, they have had Lumen. And then lastly, did you know that Lumen chemical peels were developed by Dr. Trewick and Dr. Winiger, our two co-owners of LUX Medical Spa? 40% of you so far, 40% say they did know that, 60% said they did not know that. All of our Lumen Skin Care is created by our two board-certified physicians, Dr. Carmen Trewick of May River Dermatology and co-owner of LUX Medical Spa, and Dr. Frederick Winiger of Winiger Plastic Surgery and co-owner of LUX Medical Spa. Just to go back real fast, 90% are here because they'd like to learn more about chemical peels. 20% have used Lumen Skin Care products, so want to know more about chemical peels. And 50% of you want to win the free chemical peel. So that is awesome. LUX Medical Spa has been open since 2014. Our Lumen Skin Care line of products that is developed by Dr. Trewick, Dr. Winiger, with the input of all of those staff, was developed and launched, I believe, in 2017. They work with a chemist who's involved with lots of skincare lines, and joining us today is Jamel, who works directly with that chemist. So she's going to go through our slide deck here on our chemical peels and peel pads. She's one of our experts. Also, we have all of the girls on staff who's part of the development of the products as well, who can talk to you more about the chemical peels, and they're the ones that will actually do the chemical peels on you. So I'm going to go ahead and end this poll. Thank you, everyone, for joining us today, and I'm going to turn us over to Jamel. If you have any questions along the way, please use the chat feature in Zoom, and I will stop Jamel and answer your questions. And if you're watching us live on Facebook, just comment, and we'll be watching those comments as well. Thank you, Jamel, for joining us today, and I'm going to turn everything over to you at this point.
Thank you, Jasmine. And thank you, everybody that is joining us today for chemical peels and peel pad discussion. So we are going to start by talking about the peels that we can do in our office. So these are professional grade, these are prescription peels, and these are something that will bring you into the office and help you determine which peel is going to be best, depending on what you are hoping your results are going to be. So we have something for every condition that you might be dealing with. We're going to start by talking about Renew and Rebright. So this is actually a peel system. And we call it a system because there's not only an in-office procedure that you're going to come in and have the staff do for you. There's also a 30-day supply of products that you're going to use. That 30-day supply of products is going to be something that you are going to use exclusively, and it will also be a big part of the results that you experience. The Renew and Rebright is exactly what it sounds like. It's to make your skin brighter. It's to help with pigment. So whether you have spots from sun damage that are bothering you, or maybe you have melasma, also known as pregnancy mask. Hyperpigmentation can be something that you could get from acne. So if you ever break out and you get the spot that lasts longer than the actual acne breakout, that would be something that this can address as well. So its primary focus is pigment or brown spots. Secondarily, you are going to get a lot of anti-aging benefit from this. So we use a very high dose of vitamin A, which is prescription. So you might hear it under the name Retin-A or tretinoin. And that is going to be part of the procedure in the office. We also use a 3-acid peel that will go over the top of that. It's painless. So it's very, very comfortable. If you've had chemical peels before, it's unlike probably anything that you've had before. So you don't have to sit and tolerate something that stings or burns on the surface of your skin. One of the things that makes this unique is that it is what we call a non-wounding peel. The nature of chemical peels is that the acid, in general, the acid is meant to harm your skin because your skin is smart enough to repair itself. So a lot of what we do in this industry with our aesthetic and cosmetic procedures is we create a wound and then our skin heals it and makes it as good as new and better than before. In the case of our Renew and Rebright, it is non-wounding. So it is very comfortable. There is very little downtime associated with it. You will actually leave the office with the peel on your skin for 2 hours. It'll look a little shiny and a little yellow, but it'll be very comfortable, and we can even put sunscreen over the top of it to protect you. And then after that 2 hours, you will go home. You will remove it with the cleanser that you're provided in our Lumen line. And then you will start to follow a very simple set of instructions for what you do for the next 30 days. So you're provided with a cleanser, a moisturizer, a sunscreen that's completely physical, a soothing balm, which is a hydrocortisone to help you if there's any itching right before you start to flake. And then you're also going to get a customized Rebright cream that is also going to be prescription strength for you to use every night for 30 nights, just not the night of the actual peel. In terms of downtime, so if you've never had a peel before and you're concerned about what that might look like and if you can go into public and what you might feel, it will feel like a very mild sunburn at worst. It will start to flake, not peel, at around the 3-day mark. And so you'll just have light, fluffy, flaky skin, maybe be dry, maybe be a little bit red. There are no restrictions on makeup, so you can actually wear your makeup the next day. And then as your skin starts to acclimate to that customized product, it will start to just improve day after day after day. And then your skin won't be red and it won't be flaky and it will be smooth and bright. And a lot of the brown spots that you were dealing with will be resolved. And so it is something that you'll continue to see that improvement for. After that 30-day mark, you'll come back into the clinic. You'll meet with the staff and they'll help you put you on a regimen that will maintain the results that you get from the Renew and Rebright. This peel can be done on any skin type. So whether you're fair or whether your skin is darker, it is safe to use on all of those skin types, which is also a wonderful benefit of this. This peel would actually be the equivalent of what you would see in a normal series of peels. And we'll talk about what that looks like in our next slide. So normally with lower strength peels, you might have to do 3 or 4 or maybe up to 6, depending on what you're trying to treat. This one will give you the results of a series of peels in one peel procedure with that take-home regimen. If anybody has questions about that.
Hey, Jamel, we did have a question about that, and I think you'll probably answer it in the upcoming slides. But it came in via Facebook, and she says, I have rosacea. Would this work or not?
Perfect timing. Okay. So if we are dealing with primarily the redness from your rosacea and maybe just the texture, redness, oiliness, dryness are all those side effects of rosacea. Renew and Relux will be a better peel for you. So this one has acids that are meant to help with inflammation, to help reduce redness. They will help smooth the skin, so they're certainly going to help with texture. but these will be a better alternative for you. Whenever we deal with rosacea specifically, we don't want to exacerbate that condition. So we want to calm the skin and help to reduce everything that's bothering you, but also improve the overall health and texture of the skin. So the Renew and Relux is great for that. We can use it on sensitive skin. It's also good. There's a lot of patients that suffer from acne that also have sensitive skin. So this might be a nice gateway option for them if they're afraid to do a peel. This is a very gentle peel, yet still very effective. This is also nice for pigment. And so there are some rosacea patients that also have pigment. This will give you an option to treat both of those, but more gently. So this would be something where you might need a series of those. You might need 3 of them spaced 30 days apart, or you might want to just continue to do one every month for 6 months, or as often as you feel like you really need it. There's no harm in doing a chemical peel. So as long as you allow your skin to recover, then doing another peel at that time, if you feel as though it really helped you and you felt like it made everything look better, is perfectly safe. So this one is actually customizable. So we can make it something that's extremely gentle for somebody with sensitive skin and redness prone skin, or we can boost it to make it stronger for somebody that might want to deal with pigment or acne. And we determine that based on what your allowable downtime is, what condition it is that you're treating, and what you feel like you are trying to accomplish from one peel to the next. So you might do something very gentle on your first visit, and maybe you realized you can do something a little stronger on your second visit. So the Renew and Relux is great because we can change it and just customize it to what you're feeling like your skin needs at that time and what you're capable of tolerating as well. Again, with the Renew and Relux, no discomfort, so no pain. The associated flaking with this, we call them chemical peels, and I think a lot of people that have had peels in the past are accustomed to really heavy peeling, maybe where your skin might get darker and kind of crust up before it starts to peel. You won't experience that with our in-office chemical peels. So I feel like that is a benefit, but for people that really, really like that aggressive peeling, it's not something that you are going to see with these, but you will still get results. I think that that is a huge benefit. The Renew and Reglow is going to be something that's going to be stronger. So we're not going to do this on a sensitive patient, but this one has different acids that are more exfoliating. They're still great for redness and inflammation and inhibiting, stopping the creation of abnormal pigment and brown spots. It does have an antibacterial component to it. So this one is going to address texture. Texture could be wrinkles, fine lines, rough skin, large pores. This particular peel, the first acid that you see is really good at addressing the appearance of large pores. And acne is also something that's considered textural. So this will address the bacteria from acne as well as the texture. And you will get a lot of brightening from this. So that Reglow, it's going to restore your reflective shine to your skin. This one, again, no discomfort. It is stronger, so you will flake a little bit more and maybe a little bit longer. We can still do this one in a series. So you might want to do 3 and you might want to do more, again, just depending on what it is that you are trying to accomplish, and the staff will help guide you through that. We can make this one stronger. We use a prescription strength vitamin A with this one, and a very strong retinol that will also stay in contact with the skin. So with all of the peels, you get the benefit of the acids. You also get the benefit of that really great anti-aging component of the retin A. And then we can change all of that depending on what you want to see happen from peel to peel. Then in your home, so in between peels, you can also maintain what it is that you're doing with the peels that we can do in the clinic. Or maybe you want to start with something that is a little less aggressive. Maybe you haven't done a peel yet and you want to start with something that you can do at home and slowly work your way up to doing something that's more professional strength. Our sensitive peel pads would be that introductory level. So if you do have redness prone skin or rosacea or sensitive skin, these are a really nice starting peel pad. You're going to do it once a week to begin. With all of our chemical peel pads that you're going to use at home, contact time is going to determine how much or how little flaking you might get from those. So we do suggest that you take one saturated pad. In our sensitive peel pads, there's 60 pads in there. So if you're using one a week, that's over a year supply. So you're going to take one of those saturated pads out of there. The acids that are in here are lower dose, much lower dose than what we use in the clinic, so that you can use them at home more frequently and safely. And they're going to be good for reducing redness and inflammation, and they have an antibacterial acid in there. You take that pad and you smooth it all over your skin, avoiding your eye area, and then you let it stay in contact with the skin for 5 minutes, 10 minutes, maybe 15 minutes to start. And then you're going to remove it or neutralize it with a cleanser. So you're going to wash that acid off of your skin gently, and then you've neutralized the acid. And so you get a nice exfoliating result with all the other benefits that the acids provide. The next time that you do it, maybe you want to increase your time. And so you continue to do that until you get to the point where your skin looks beautiful. Maybe you have no side effects whatsoever, no flaking, no dryness, but your skin just looks healthy and fresh and reflective. So it does give you some control over what that might look like. If you decided that you wanted to put a peel pad on and sleep with it, then you're going to get a much stronger result. And you might, in effect, have more flaking and dryness that would be a little bit more persistent. But you cannot harm yourself. So that's the nice thing. It just is going to depend on what you are trying to do with those peel pads at home. If you get to the point where you feel like keeping it on for 30 minutes is perfect, and maybe you want to do it more than once a week, you can do that as well.
We have a question from a patient who actually uses these sensitive peel pads. She says, when using the sensitive peel, she says, when using the sensitive peel pads, is there a certain period of time before, well, maybe she doesn't use it, I'm not sure. But she says, is there a certain period of time before or after the peel pad that I should stop using the Lumen Ret 100? She uses that daily.
Oh, that's a great question. So you're just going to make it work better. So you don't have to stop using it. If you are okay and you have used them and you've done that, that's perfectly great. If you haven't tried that yet, with the sensitive peel pads, if you're using the Ret 100, then you can already tolerate a very strong retinol. That's a 1%. So you are going to be fine using them in combination. So you're going to apply your pad, leave it on for your 15, 30 minutes, whatever you'd like to start with, neutralize it with your cleanser, and then you can put on your retinol and go to bed. So because you're using a strong retinol, then I think you're going to tolerate them just fine. Usually if you were using a stronger peel pad, and we'll get into those as we move through the strength, I would not suggest using them in combination on the night that you treat, just because of the strength of the peel pad itself. But if you wanted to increase the amount of peeling or flaking or dryness that you're getting, you can use it in combination with a retinol, similar to the way that we do in the clinic. So we always use a very strong prescription vitamin A and then do the peel solution so that we do get better penetration and a little bit more flaking from that. So you would be doing something very similar at home. Good question. Thank you. So then we move on to our brightening peel pads, which is a step up. These are the same acids that we have in our Renew and Rebright peel at much lower concentrations. So you would be doing great maintenance if you've already done the Renew and Rebright, or this would be a good starting point for you to start with these acids that are going to help with redness and to stop the production of abnormal pigment and with bacteria, and just to get a nice gentle exfoliation. So these you're going to use in the same manner, and you can see that these are from sensitive skin all the way to acne prone skin. They're great for all of those indications. They're still very gentle, so you might not see very much flaking or dryness. 60 pads, again, same method. You're going to take the pad and apply it all over your skin, allow it to sit for a certain amount of time, and then neutralize it with your cleanser. The glow pads go up in strength substantially, and now we're closer to our in-office Renew and Reglow peel. So these are the same acids that we have in that peel, again, at lower concentrations. You are going to see a lot more flaking from this just because of the nature of the TCA acid that's in there. There's an antibacterial acid in there with salicylic acid, and the azelaic is good for reducing redness and helping with pigment. So this one is going to be better if you are dealing with the appearance of large pores, or if you have no brown spots on your skin whatsoever, this is a better choice for you. And again, it's mild to intense exfoliation, depending on how long you allow it to stay in contact with the skin. This is great for patients with acne, very, very effective. 60 pads again. So if you're only using it once a week, you're going to have over a year supply. If you decide to use it more frequently throughout the week, I would just suggest using a lower contact time. We never want your skin to be constantly peeling and constantly red and constantly dry. So it is better to use these for a short amount of time more frequently if you'd like to, than to use them for a long amount of time and have more downtime associated with that, unless our goal is to just do a weekly refresher, a weekly exfoliation. Now, our strongest peel pad for at-home use is called our exfoliating peel pad. So these are extremely strong, and these I highly suggest using for a very short amount of contact time because they are a very low pH. So these would be the equivalent of something that you would see in the clinic, something that we would leave on for just a couple of minutes. You can use these for a longer amount of time, but I would very slowly work your way up to there. Possibly even try using a couple peel pad steps below this before you work into this. This is what I would call for the advanced user. So somebody that needs a lot of exfoliation, somebody that's been using a very effective regimen with a prescription strength vitamin A or a very strong retinol in their regimen. These are going to give you a lot of exfoliation, and you will definitely see the effects of that for anywhere from 14 days. So you're not going to walk around looking really dry and flaky and peeling. But for instance, I used one 4 days ago and my skin is still gently sloughing off when I cleanse it in the shower. I'm having to use more moisturizer. It looks better. I was getting some of that awesome maskne that we talked about in our acne presentation. And so I needed to really just conquer that really quickly. But that's some of what you'll experience afterwards. So these are great for texture. It is glycolic acid, solely glycolic acid at a very high concentration. So with this one, you might need to wait up to 14 days before using it again. There are less pads in this particular container for that reason. You're not going to need them as often, and just be cautious of your contact time and slowly work your way up to the time that suits your skin best. And we're also happy at the clinic to help find the right pad for you if you'd like to use any of these and help you deciding on what your contact time should be. And that was the last of our peel pad and chemical peel presentation.
Wonderful. Thank you so much, Jamel. Please send us in some questions. Lots of good information. So basically, to recap, we have 3 in-office chemical peels. I like to think of them as, in my mind, I think Renew and Relux, Renew and Reglow, and Renew and Rebright. And so that's kind of in the strength of how they go. And then each of the peel pads, in a way, complement those. So remind me, Jamel, is it right? Like the Glow pad is very similar, the ingredient-wise, to the Renew and Rebright. Is that right? Or no, the Renew and Reglow.
Yep.
Yes, because Glow. That's right.
Yep. Perfect. And then our Renew and Rebright.
I love that one.
Brightening pads.
Right. Got it. Yes, that's right. So they're complementary because you can do, it's kind of like going to the gym and having a trainer. Well, you still have to do stuff at home that encourages the healthy skin as well. So send us some questions if you have them. I know everybody is excited to see our spinner wheel again. So I'm actually going to take over. Oh, we have one. So she said, I would like to get to my outdoor activities. Therefore, how can you safely get outside after a peel? Sunscreen, what about the humidity? That's a really good question. Jamel, I'm going to let you
That is a really good question. So when we are doing the in-office procedures, you will get some instructions to safely return to being outside and enjoying a walk, a hike, tennis, golf, whatever it is that you're doing. Yes, sunscreen is extremely important, especially after a chemical peel, and depending on which one you do. So our Renew and Rebright, our strongest of the ones that we discussed, is going to give you a few days where you really don't want to have any prolonged exposure. If you do go outside, you don't want to get the peel and then go play 8 hours of golf. So you will want to have some time in there where you have a cushion where you aren't going to be doing something like that. With some of our less aggressive in-office procedures and with our at-home peel pads, as long as you are wearing a hat and you put on your sunscreen and you're protecting, you're going to be fine. But that is a really good question. The humidity might actually feel really nice. You're still going to probably need additional moisture, so supplemental moisture as you are going through that peel process and after when you're a little bit dry, but you'll be fine.
Perfect. Thank you. I hope that answered your question. Yes, she said it did. Thanks.
Okay, good.
What is the best? Okay, so second question or next question. What is the best peel for someone with darker skin and also has rosacea?
That is a great question. So just rosacea, but no brown spots that you're dealing with, I would do the Renew and Relux. So the Renew and the Relux and the Renew and Rebright are wonderful, beautiful on darker skin, very, very safe. I would stick to those two. But if you are not dealing with brown spots, then the Renew and Relux is a better option than the Renew and Rebright.
Great. And I think to add to that too, you don't have to decide on your own which peel is best for you. That's what our estheticians will help you with. So for the rest of this month, we're offering the free virtual consultations. And so, I encourage you to give us a call, or I'll show you how you can go and sign up for those online. And that way they can tell you which one is best. We can get an appointment scheduled for you. All of our peels, the Lumen peels between now and the rest of the month are 20% off. And that is for our individual peels, or if you do a package of 6. And the package is 6, it gives even better discount. So if you can't have the peel this month, but you want to bank the service for a later date, you can do your consult with the ladies now, pick out which one you need to do, and and then purchase it, and then do it whenever you have some time to do it. But yeah, those were 2 really good questions. Thank you for taking those, Jamel.
Yes, thank you for asking.
What about
those.
the peel pad? Oh, she wants to know about the peel pads. And I think she means, are those on sale as well? Yes, all of the peel pads and the Lumen products are 20% off through now and the rest of the month. With those, to answer your questions, you can call or stop by either of our 2 offices, Bluffton or Hilton Head, and you can purchase them online and we can ship to you, or we can do curbside pickup at either of those locations. Whatever your comfort level is, we can ship to you, so there's absolutely no contact. You can do curbside pickup so that you don't have to come inside, or you can just come on inside. Just make sure that you wear your mask and don't come in if you're sick, of course. But she said, thanks, great. These are good questions. What else do you guys have question-wise? Are you ready to find out who the winner is? Okay, they're not asking, so I'm guessing they're ready to find out who the winner is. So I'm going to take over my screen here, or stop your screen and start sharing mine. Will you verify for me? Are you seeing my screen that has the picker wheel on it?
Yep.
Okay, perfect. All right, so these are really fun. I don't know if you'll be able to hear it, but I'm going to give this a quick shuffle. And I'm going to spin for our winner. And everybody who is here right now should be on the wheel. And if you commented or liked or tagged people in our social media, you have extra spins.
Cool.
And our winner today is Cassie C. Yay! Congratulations, Cassie. Yeah, Cassie, I'll reach out to you, or you can give me a call, and we will. It's for the Renew and Relux peel. You can talk with one of the estheticians, and if that's not the best peel for you, or you're not a candidate for that one, I'll see what we can do about switching it out for you. But we chose that one because most people can have that. She said, amazing, yay, so happy, Cassie. So I just want to show you while my screen is up how you can go about scheduling a consult. If you just go to luxhhi.com, the virtual consultation is the very first option that comes up. Those are normally a $49 value. Right now they're free. So you can just click on there to schedule, pick a time. I will call you just to confirm the time and confirm that we have an esthetician or someone available to speak with you at that time. In order to take advantage of our special, you can just go to the shop online, but that's also store.com or store.luxhhi.com, and this has all of our specials. So basically right now all of the lumens on special, chemical peels, hydrofacials are on special, the Zoe Skin Care, which you actually can't purchase online, you'd have to call to purchase, and gosh, there's something else. Bellafill is on special this month. And then a secret for all of you, starting on Monday the 28th, 29th, and 30th, we're putting everything back on special again. So if you missed something earlier in the month that you were really excited to try to get to, that's going to be on special again. So things like Botox and Dysport will be on special again. One more really exciting news that I wanted to tell everybody, and so you're pretty much one of the first to know. We have launched a brand new line of growth factor products, and this is one of them. The Lumen Neck Define, which has been one of our best sellers for a neck product, now contains a growth factor. We also have the Lumen Restore with a growth factor, and Lumen Antioxidant Eye with the growth factor. And the Antioxidant Eye we've also revamped, and it has some other great benefits to it as well. We'll be doing a presentation on Tuesday the 29th at 3 p.m. On those product lines. So you'll get to learn more about the growth factor that's in them and the products and what they do. And of course, we'll be doing a fun giveaway, so be looking out for that. I have one more poll I'm going to send out before I let everybody go, and it just basically asks you if you would like for us to contact you for a appointment or a consult. And so if you would take a second to fill this out, or you're welcome to just exit. But thank you so much for joining us today. Of course, you've heard me say it before, that we would prefer to be doing these open houses in the office, face-to-face, but this is the next best thing to that. So we appreciate everyone who's been joining us. I see a lot of the same names over and over again, so to you guys specifically, thank you. You've made this worth it to me to do it, and I enjoy seeing you guys come every day and be so loyal to these events, so thank you so much. And if you don't want to stick around or you don't want to enter the poll, then I hope you have a great weekend. And Jamel, thank you. Will you be here with me on Tuesday? Is it
Growth
Tuesday?
Factors. I will be with you.
Yay! I'm so excited. I'm so excited about the growth factors. And we have little samples that we're giving to people too. So if you want to try them, you can stop by and get a sample. Or if you do a Lumen skincare purchase online, we'll send a sample of the growth factor with those. And those samples are like I'd say 2 to 4 week supply.
Oh yeah.
Yeah, definitely.
Especially the eye product.
Oh yeah, that can last you a month.
Mm-hmm. Absolutely.
Yeah. Well, perfect. Well, I think the people that are interested in getting contacted for an appointment or a consult have probably clicked so, and everybody else is starting to hang up. So I'm going to go ahead and end the meeting for now, and look forward to talking to everybody on Tuesday at 3 o'clock. Thanks again for joining us. And thank you, Jamel.
Thank you, Jasmine. Have a nice weekend.
Thanks, you too. Bye.
Bye.